So our Walk It Along, just a little history of how we got to this Walk Alongside You series. We started in 2020 with some virtual sessions that we developed post the beginning of COVID. And we had really nice feedback and success. And we got feedback from all of you that we wanted to expand that and have some more sessions in 2021. So we've had a session on supporting kids and young adults, supporting employees, and now this final session of 2021, health equity and mental illness. So what is behavioral health equity? This is a definition that comes from SAMHSA, and I am going to read it. I don't always like to read the slides, but I think this is pretty impactful. Behavioral health equity is the right to access quality health care for all populations, regardless of the individual's race, ethnicity, gender, socioeconomic status, sexual orientation, or geographical location. This includes access to prevention, treatment, and recovery services for mental and substance use disorders. I think that you would all agree that this is a wonderful thing for us to aspire to, and probably something that we're not quite there yet. I always like to make sure we highlight these hotlines and resources in the community. If at any point during this time or any other time you feel like you need somebody to talk to, sometimes these sessions can be trigger some feelings and emotions in ourselves. So never hesitate to reach out to the Suicide Hotline or Foundation 2, the Iowa Warm Line, and of course Your Life Iowa also helps with access for people in the community. I would like to highlight some of our local resources and people who have helped support the Make It Okay campaign in Linn County: Tanager Place, Foundation 2, Unity Point Health, Mercy in Cedar Rapids, and of course NAMI of Linn County is an excellent resource for anybody who is accessing services in our community. Without further ado, I'd like to introduce our panelists for today, who will be sharing their wealth of knowledge and work that they do. I'm going to start with Lori Ampey, who's been the Director of Programming and Outreach for the Boys and Girls Club for 22 years. She is also currently the Program Director for the LGBTQ Youth Center at Tanager Place. Throughout her career, her focus has always been on making everything she does inclusive to all children. Lori has a partner who she's been with for 16 years. She has 2 daughters and 4 grandchildren. In 2019, she had the honor of receiving the African American History Makers Award. And this year, the center received the Friends of the Community Award from the Coralville Pride Fest for 2020, and the honor of being chosen for 2022 Pride Honor Roll. According to Lori, while getting awards is okay, nothing beats the reward of making an impact daily. Tony Wilson is founder and director of curriculum development and transformation for Central City Development Corporation, a nonprofit organization founded to pursue his passion of helping individuals to regain the sense of hope needed to live a fulfilling life. He is a retired Iowa educator and Air National Guard colonel with over 48 years of experience in public education and health service delivery. Tony masterfully employs his expertise in cognitive behavioral change in working with youth, families, and organizations to mitigate the impact of trauma, stress, and stressors in their lives. Tony is an author, a father to 4 daughters, a grandfather of 3, and a great-grandfather of 1, who is dedicated to sharing his message of hope and building stronger communities. Sarah Zanuck is the Director of Refugee and Immigrant Services at the Catherine McCulley Center. After obtaining a BA in International Relations and Religion from Wartburg College and an MA in Intercultural Service, Leadership and Management from SIT Graduate Institute, Sarah has dedicated her career to providing and leading supportive services to refugees as they work to find stability and safety in their new communities. In her role as the Director of Refugee and Immigrant Services, Sarah is committed to ensuring that community members, partners, and local employers have the information and resources necessary to work effectively with diverse populations. And finally, Amy Hockett is the Public Health epidemiologist at Linn County Public Health. As the only epidemiologist for the agency, Amy is responsible for monitoring a wide variety of public health related issues and assisting in informing community action, both within the agency and throughout the county. Amy holds a PhD in public health epidemiology and a master's in public health with a concentration in community health from Walden University. As a Bachelor of Science, as well as a Bachelor of Science in Human Biology from Grand Canyon University in Phoenix, Arizona. Amy is passionate about affecting community change through collaborative action. And I am going to unshare my screen so that Amy can share hers, because Amy's going to start with sharing an overview of some data for us. So I'll pass it off to you, Amy.
Thank you, Carol. Okay, can you hear me okay?
Yes.
Okay, very good. You never know if you mute yourself. Okay, yeah, so I'm just going to go over just some tidbits of information that we know about mental health and kind of the trends in our community. And I can get it to go. There we go. So the first one, this is actually a self-reported incidence of how many days in a month adults feel kind of have poor mental health, and frequent mental distress is kind of identified as 14 or more days and over a month period. So that's kind of where we'll stick with. So approximately 12.8% of adults in Linn County experience frequent mental distress. 15.6% of adult females and 9.9% of males identify as having at least 14 or more days. Among our Black respondents, 35.3% report more frequent mental distress days, 33.5% for 2 or more races. Both of these 2 racial categories are 7 times greater than the other groups that we look at. When looking at deaths by suicide, you can see over time, it's kind of fluctuated. The 2021 data is actually only updated to up to July 12th of 2021. So that's a significant issue. And I think, as we have these discussions today, I think it's more apparent as we're continually dealing with crisis in our community that even our crisis service individuals are experiencing higher rates of suicide ideation and these issues. So this is a very terrifying trend, I think. By demographic characteristics, we see a particular high among that kind of 25 to 64 year age range. The 15 to 24-year-olds is also a very high statistics, but that age category is typically more in hospitals rather than deaths. And then among suicide deaths, we see it a lot higher among our male residents. And this is typically because the deaths are associated with more firearm use. When we're looking at our hospitals, you'll see the 2 at the top are related to our hospitalization or mental illness related hospitalizations, but the 2 line graphs or the 2 lines at the bottom are self-harm specifically. So we have smaller number of self-harm, and it's been pretty consistent over time. In 2020, there were approximately 166 visits to the emergency department for self-harm. More than 3,100 of those visits were for mental illness. Among these mental illness related visits, 28 or nearly 2,900 were actually hospitalized for a mental illness related encounter. So this also includes if it has something to do with drugs or alcohol. So it's kind of all encompassing. While we saw in my previous slide that males are more likely to die by suicide than females. Females, particularly between the ages of 15 and 24 are more likely to be hospitalized or go to the ED, the emergency department, for a self-inflicted injury. However, when we look at all kind of mental illness related hospitalizations and visits, males are actually account for a larger proportion of these hospitalizations, particularly the 15 to 44 age. And then we kind of see, this is between 2017 and 2020. This is just mapped out the hospitalizations based on where that individual resides. So we'll see like the darker and the 52404, that's the highest proportion of hospitalizations related to mental illness. And then we'll see kind of in this downtown area, a little bit more concentrated. One of the things I forgot to say, so in 2020, because of COVID, we did actually see a lower number of individuals going to the emergency department. So it's a little bit skewed just because of that the hospitals were shut down. So we know that there were likely a lot more incidents than were kind of captured because of this. So our age categories, so we're looking at both the emergency department and hospitalizations for mental illness particularly. So you'll see kind of more skewed towards that 15 to 24 for our hospitalizations, and then kind of goes down from there. And again, this is more of the females, and poisoning is typically the reason. And then in your emergency department, it's kind of spread a little bit further out, but still sticks in that kind of younger age range. Now, this is very telling. So we're breaking it down by race and ethnicity. You see that even though our overall rate is pretty similar throughout the years, if we break it down by race specifically, Black African-American residents are at a significantly higher risk, occurring a lot more in this age group or in this race group. So for hospitalizations, we have a 6 times that of, where you see the check mark, it's kind of the reference group. So the group that kind of did better or has a lower rate, it's 6 times that of 2 or more races in that category. So that's a significantly higher issue among the Black African-American. So I did include Voice of the People, and this is just, we're currently going through a community health assessment, and we're hearing a lot from our community as to kind of the barriers that they're experiencing, they're seeing, and we see there is a significantly larger burden on our low income and residents of color than across the rest of our county. Kind of the same things are still being said, no matter what income level, age range. But there is an additional burden on our low income residents, particularly around insurance, with Medicaid not being accepted a lot by the mental health providers, the copay being a little too expensive, not really having the providers that kind of meet the population, or look like me is basically what we've heard a lot. I don't have a provider that looks like me or who kind of understands where I'm coming from. The constant stressors right now. So we know that mental health isn't just mental health. You're dealing with a lot of things. So kind of combining the housing issues, the food access issues, childcare, there's just so much that our community is dealing with right now. And really our people of color have been dealing with these kind of same situations over a very long period of time. And it's just becoming worse with COVID and derecho, which we'll talk more about. And then also our low income residents are dealing with that kind of same thing. And then our resources are kind of dwindling. So we need so it's so much more burdensome now than it was in a previous kind of scenario. And then, hours of operation not being flexible. So it's kind of similar with that low income needing to have shift work, like having something that actually works with your time, and childcare again comes up. So I just wanted to include that, just so that was kind of a basis for where I would like to kind of highlight.
Thank you, Amy.
Yeah.
I want to clarify, all of that data is Linn County data, right?
Yeah.
Okay.
Yep.
Just wanted to clarify that. Really interesting data. Some of it may be surprising for people, some of it probably not. But I think that last slide was really important, just to kind of highlight the social determinants of health and how all of that impacts our health in general, right? Our physical health as well as our mental health. So thank you so much for that. I think that's a really nice place for us to start. And as Amy sort of indicated, we'll talk more about how COVID has impacted the communities that we serve here in Linn County. But first, could you guys take us back to some of the barriers that existed even before the pandemic or the derecho or all of the stuff that we've gone through the last 20 months? So kind of go back and talk through with us, what were some of the barriers that we were already seeing? And I'll let whoever wants to go first, go first.
I can go first. Thanks for having me. For the center, one of the biggest barriers that was pre-COVID was there wasn't a center. So for just a tad bit of history with the LGBTQ Youth Center is that it actually started at the Boys and Girls Club. And what it was I was seeing a big increase in students who were kind of questioning who they were and were identifying differently. And then we also had a big increase in same-sex parents. So a lot of questions were kind of coming into play. So what I did was I hosted a couple of events monthly for about the next 3 months. Quickly, the events grew to over 100 youth that participated. So we became in a position where we were in a dilemma. We did not have money as a Boys and Girls Club to start, have another building and start something else. So I went to Tanager and said to Opara, we need a space for these kids to go. I don't have any money, but I need help. You have space. If you give me space, I will come and work for free. And so the rest is kind of history. Tanager really knew that serving children was about serving all children. And they welcomed the center with open arms. Without Tanager, we wouldn't be here today. But that was one of our biggest obstacles. And now that the kids have a safe place to go, parents have a support system, that kind of takes away the biggest barrier that we had. So
that's awesome. That's amazing. Thank you, Lori. Tony or Sarah, do you want to jump in?
Yes. So I was an educator, minding my own business, loving what I did. And I made the mistake of getting involved in community work. And the more I got involved, the more I realized that there was a sense of hopelessness in the community. And so that's really where I started this journey. And then the more I worked with people, I realized that the one common factor of most of the issues that they were facing was stress. And, it's really difficult to address employment or education or anything else unless you deal with the stress. And that's one of the social determinants of health, one of the domains. And so stress has always been high. And that information that showed you that stress and trauma is something that's impacting, especially the Black community, but all communities, everybody's experiencing the same. But so that was a fact that existed, and it was impacting people spiritually, emotionally, physically, in every way. So one of the ways to improve mental health that I could do from my perspective was to help people learn how to deal and manage their stress. So that's what I've been doing for the last 20 years, probably, is dealing with that. And I've seen some great results, whether it's working in prisons or did some work with the United Way or all the organizations I work with. Everybody is dealing with stress. And so that's the one factor that we identified, and that's what we've been working on since then to help reduce that. And we believe that once they reduce their stress, then they can think more clearly, solve problems, and are better prepared for employment, for all the other domains of the social determinants of health. So that's been our approach.
Awesome, thank you. Sarah, how about the refugee community? Pre-pandemic, what were some of the barriers that you were experiencing?
Yeah, I think about that slide that Amy shared, with that last slide with the barriers to mental health care. And when we talk about refugee and immigrant mental health, and barriers to seeking care and accessing care, it really checks every single one of those boxes, to be very honest. Limited access. There's very few providers that look like our clients, that speak languages that our clients speak. When you talk about mental health services and communicating what you're experiencing, and you have to add in a translator to that mix, it creates additional barriers. Just the need to incorporate a translator and being able to tell someone and comfortable telling someone. Translation adds an interesting dynamic as well with in-person translators versus virtual translators. Oftentimes, if they're in-person translators, they're people from the community. So they may be someone who goes to church with the person seeking care or sees them at the grocery stores frequently. It may be a neighbor. And so there's additional dynamics there when you add in translation. But we talk about the stigma to seeking care. Many times our refugee and immigrant communities have a high level of stigma. Maybe mental health isn't understood as well or explained in the same ways as mental health being part of your physical health and part of your overall well-being. In a lot of different communities, in immigrant communities, but also in US communities, we see mental health as symptoms of different religious or connected to religion in different ways. And so sometimes we'll hear clients say that they're not experiencing mental health systems. Perhaps they were cursed, or they believe that they're sinners. And so that this is the burden that's put upon them because of what they believe or where they kind of how they see that connection. Cost of care, scheduling, availability of appointments, all certainly play into people's ability to access care. And then there's, the big elephant in the room that we really can't avoid when we talk about refugee and immigrant mental health and mental health access is just the sheer amount of trauma that refugees and immigrants have been through in leaving their homes and coming into new communities. They're entering into new communities as low-income individuals. And so then that layers on top of what they've already experienced, the trauma they've already experienced, and it adds in the trauma of being poor in this country and the trauma of trying to get by. And so, another layer that we see is also many of the refugees and immigrants that are resettling are people of color. So you add in the dynamics of being a person of color in this country. And it just, the layers continue. And we get back to even that root issue of you've fled your home, you've fled a place that's comfortable, that's known to you. And oftentimes people don't haven't been able to address that trauma, that piece of, I've experienced a great loss. And now I'm continuing to experience loss and experience trauma, and how can I process it while I'm also in the thick of it? So there's layers upon layers when we talk about mental health with refugees and immigrants.
Yeah, thank you for that. You're right. It's always nice to, I think sometimes we know that. We know those layers are there, but, to really take some time to think about it is impactful for me. Okay, I want to dig a little deeper now because that's what we said we were going to do. So what are some of the unique challenges that have emerged in the communities that you all serve since the pandemic? And, since we live in Linn County, we'll also throw in since the derecho, because I know that has impacted many of the people that you guys work with. And Sarah, you're on my screen still. So how about if you go first?
Yeah, certainly. It has been an interesting 2 years at this point. And when we look at the impact and kind of the unique challenges that refugees and immigrants have experienced, there's no denying the impact of the derecho. There were large numbers of refugees and immigrants that were displaced because of the impact of the derecho. And then you add, again, language access and people's ability to access services and understand what the insurance processes and FEMA payments and what are all of these new resources and services around us, just adds to the layers of stress. But looking at the past 2 years really as a whole, and kind of seeing what unique challenges have come out for the refugee and immigrant community, it really, a lot of it comes back to language. A lot of it comes back to the accessibility of services, and with that, an understanding of what services are available to people. Using derecho as an example, we opened an emergency shelter because there simply weren't, there was trauma associated with going into mass sheltering for especially for our refugee community members. Their mass sheltering looks like a refugee camp where people spent oftentimes decades living and needing to rely on other people. And so we heard in conversations with community members in the days after the derecho, what is your fear? What's the hesitation in going to a mass shelter? Why are you choosing to create a shelter outside of the apartment that's damaged over going to a shelter? And from several people, we did hear that it's like the refugee camp that we left. And when we went into a refugee camp, we were there for decades. We were there for a very long time, and we had no guarantee of when we would be able to leave, when we would be able to find that safety and stability again. And we're afraid that that might happen again if we go into a Red Cross shelter. And so there's all of these ties to what people have experienced in the past. And then the layers of power dynamics and who's staffing the shelter. Can I communicate with them? What happens if I have an emergency? And, kind of broadening it back out to just the pandemic and the past couple of years as a whole. While Linn County has done a wonderful job of getting information out, there's still language access challenges that people then have the push-pull between what am I hearing from my community members and what am I hearing from the county or from the city, and concerns about, can I trust someone that I don't know who's in a political power versus someone that I've grown up with or someone that looks like me and talks like me. And so people are constantly having this kind of back and forth in their heads and challenged with that. And then I think there's also no denying that there is a certain rhetoric that has come out about refugees and immigrants, especially as related to the pandemic and higher rates of spread, or people saying immigrants are bringing COVID into the country or immigrants are perpetuating the spread of COVID. And I can't stress it enough that while, we talk about language access and language as a barrier, oftentimes our refugee and immigrant neighbors hear what is being said, and that weighs heavily on them.
Thanks, Sarah. Somebody else want to jump in on that question? What are some unique challenges that you've seen in the work that you're doing as related to the pandemic and the derecho?
I think the sense of isolation that people were feeling as a result of the derecho, when they lost telephone, internet communication, and the same thing as with the pandemic, people were isolated, used to working in groups, social groups, which led to helplessness and hopelessness and depression. So just that isolation made people feel like, they didn't know where to go and where to turn to. So that was the main thing. And like I said, once you are hopeless and helpless, then that leads to depression, which is all this is just another form of stress, severe form of stress, as well as trauma. So it's really, I think the isolation and the helplessness was the unique thing that emerged.
For the center, it was kind of a double-edged sword. It was kind of, um, this kind of comes from the kids at the center. So that's kind of where I'm taking all my information from. But for a lot of the kids at the center, every day going to school was a chore and is a chore. The bullying that they face just constantly at school. When COVID hit, it was almost a relief. So listening to some of the kids, they shared a lot of, when they didn't have to go to school for that year, they didn't have to worry about being picked on, being called names. But the downside to that also came when you were at home in an unsupported family. So, you could get away to school and still be bullied, but yet you had a little bit of freedom. But when COVID hit, you had to go home to an unsupportive family who, didn't understand you, didn't want to hear what you had to say. And then, Zoom takes away, I think Tony kind of said it best, Zoom takes away from that connection that you're able to have with people and have with other kids. And while we did do Zoom, it just didn't give them the social skills and that social interaction that they needed. Because most of the kids, I would say 100% of the kids that come to the center are struggling with definitely high anxiety, depression, suicide thoughts are very high. So COVID was really a double-edged sword for the kids at the center.
That's interesting. I would say that's the same thing that I've seen with the kids that I work with here at the hospital as well. So I'm glad you pointed that out. Just out of curiosity, Lori, did you close like doing people coming to your center for a while and do just Zoom for a while?
We closed for a little bit. We had to get creative. So when it was the warmer months, of course, we were able to go out and talk to the kids and hang out with them kind of at a distance.
Mhm.
We tried to do a lot of park stuff. So even though we couldn't be right next to each other, we could kind of be at least see each other. So for them, it seemed to work. So yeah.
That's good. Thank you. We've all had to get pretty creative, haven't we, in the last 20 months or so? And I'm with you all. I'm craving the in-person stuff too. I'm waiting for the day we can do some of these in person somewhere. Just this is for all of you. I want to focus on, kind of maybe what we have done well in the community. So what have you seen as a strength in our local communities in terms of cultural competency and taking care of the people that you work with, and in the last 20 months in particular, but just in general, what have you guys seen? Have you seen some growth areas, or what are some positives that you have seen?
Well, my work in Linn County is really centered around the gun violence initiative, and really some amazing things have happened. But one of the things that is really, I think, is a game changer is that we're doing outreach as a community. And so the people that we're outreaching, most of the youth that are involved in gun violence in Cedar Rapids are African-American males. And so we are able to take a team of African-American individuals, which we call credible messengers, and speak with them. And so we automatically have more of a cultural lens and are able to deal with them that way. So before, we've always relied on just the general nonprofit community, and it's not always reflective of the people that they're serving. So just being able to take people from the community to deliver the message. And the other thing that's really been helpful is the number of people that have come on board to help with that. So we have law enforcement, we have nonprofit organizations, we got the hospitals, we got Waypoint. So just people that have skills and talents, we're actually able to take those to the people rather than having them seek them out in the community somewhere. So that's a cultural messenger and a broad spectrum of people who are able to help and support them.
Excellent. Excellent. Anybody else want to share?
I think for the center, one of the things that I've noticed is that people have created a lot more signage saying that they're a safe place. You can go around in the community now and see things that represent someone either being an ally or just being supportive. And I know the kids mention that a lot. I have noticed that in organizations and corporations, their forms are changing. The way they put out their employment applications look different. The way they look at their health and insurance that they provide looks different. I think change is coming. You have invited me to a panel, which is creating and bringing awareness for the LGBTQ youth. So I see things slowly changing, but they are changing.
Yeah. Oh, go ahead. Go ahead, Sarah.
I was just going to say, Lori, I absolutely agree with you on those things. I think representation and just the general community awareness, as well as, the opportunity for organizations like CMC to present, to participate in panels like this. Numerous ECBOs, or ethnically based community organizations, are getting involved and are being asked to participate in conversations about how can we target messaging and how can we really make sure that the messaging that we're putting out is culturally relevant and effective and is able to connect with people. So I think, change is always a slow moving train, but I think we are definitely moving on the tracks.
Thank you for that. I like what you guys said, and part of what I think that sometimes those of us who have been on this earth for more years than other people, we sometimes will sort of be like, oh, those young people. But I'll tell you what, being in this work for a really long time, when I talk to young people, I get really excited about how much more open they are to talk about their mental health, for one thing. They're so much more comfortable talking about that, talking about their sexuality, talking about, who they interact with every day, than I think people who maybe grew up a couple of decades ago were. So it's exciting for me to see. And as polarized as our world can be sometimes, I think some of those young people are going to help bring us back together. So when Tony talks about hope, those are the things that give me hope. I can tell you that for sure. So, all right, I kind of want to move into, our time goes fast on these panels. So we're getting down to close to 15 minutes, and Sarah has a clock behind her, so that's helping me keep track of my time. I would like you guys to talk about what is, and I'd like to hear from each one of you. What is, maybe one or two things about how that the general community can demonstrate to support, provide support for our community on an individual basis. So me, not as a director of behavioral health, but as a community member in Linn County, what's one or two things that I can do to support our progress and moving forward?
So I'll go first. I think the first thing that we can do is put on our mask, and not the COVID mask, but the kind of mask they talk about when you're on an airplane, and they talk about in case of sudden loss of cabin pressure. So if we engage in self-care first, because we really can't go out and help anybody else until we have taken care of ourselves. So that's number one. And then second thing is just make sure we treat everybody that we deal with dignity and respect. I think if we do those two things, then we'll make great strides ahead.
Tony, I love that you just used the oxygen mask correlation, because we use that with our clients all the time. It's something that one of their first experiences in traveling is that speech of put on your oxygen mask first. And I absolutely agree with you. And I think that's very key, is that we're caring for ourselves, but I think also making sure that we're talking about it. We're talking about our mental health and what we're doing. And because like I said very early on, our refugee and immigrant neighbors hear the conversations that are happening. And if we are working to destigmatize it, it will also work towards destigmatizing it with our refugee and immigrant neighbors. How are we talking about our mental health? How are we talking about access? And then being a broken record, also making sure that there is access to language support for people who have limited English, so that they're able to communicate with providers and receive services.
And I think for mine, I mean, I kind of echo what everybody else has said, but I also just try to tell people to just be kind. I mean, you got to remember, I mean, it sounds simple, but it really is just be kind. I mean, if someone has asked you to use a pronoun, you may not understand it, but that's their preference and that's their choice and how they like to be identified. So be kind and you know, just because we don't understand it doesn't mean we have to knock it or, you know, belittle it. So I can't add any more than just be kind. Inclusive. Be inclusive. Make sure you're not excluding, but you're including.
Amy, anything you want to add to something you think we can do in our community as an individual?
Yeah, so I think just sharing stories, that's a lot with my work. There's a lot that we don't know. We have a limited lens. So just sharing each other's stories, I think would be very impactful. And again, be kind.
Yeah.
We're all dealing with something.
That's right. Can't say that enough. I think, you know, what all of you said is, you know, we're all going through something. We're all stressed. We all have days of being more hopeful or less hopeful. And I think if we could all take a deep breath and give everybody a little bit of grace, and including yourself, give yourself grace first. Really quickly before I move into the next question, Sarah, if I'm, you know, a person in my community again, you know, maybe somebody at my church, and there's an immigrant there who doesn't speak English. Can I reach out to you or somebody at Catherine McCauley Center to help me figure out how to communicate with them? Again, assuming I'm not with an agency, I just want to build a relationship. How could I do that?
So absolutely, there's a number of different options. We do one-on-one English tutoring. So that is always a great opportunity for someone to, both students and community members, to develop relationships with non-native English speakers. But also, yes, especially if there's concerns about resource accesses or access to resources, we can provide case management services and help facilitate conversations that can make those kinds of connections. But there's a number of community groups and churches that do that. You know, refugee and immigrant community member connecting with native born or people who've been here longer, that do provide opportunities for those connections really well.
Excellent, thank you. I'm sorry, I'm going a little bit off the, I tend to do that sometimes. I go a little off the script, but you know, it popped in my head. I was thinking about that. So as we sort of enter our last 10 minutes here, and for people who are, you know, in the audience, so to speak, if you have questions, please feel free to put them in the chat. Between Jamie and I, we're moderating them. But this is just a big picture question for all of you. What is your one hope for Linn County and the communities you serve, say in 2022? We're all hoping, remember last year, like at the end of 2020, we're all like, 2021 is going to be awesome. So that's how I'm feeling about 2022. It's a new year. We're going to start fresh, and maybe even a little longer term. It's sort of like that interview question. What's your short term? What do you see us? What's your hope for next year? And then a little bit longer term. What are you hoping where we might be in about 5 years? Anybody can go first this time.
I'll jump in because I think it ties a little bit to the question that you asked, actually, Carol. You know, and I'm stealing this a little bit from our director of education, but it also is truly my dream as well, that as we get back into community, as we are having in-person meetings, as we are kind of reconnecting with the world around us, that people will have connections with their refugee and immigrant neighbors, that they will develop a relationship, whether it's seeing someone at the grocery store or talking to their neighbor that sometimes you stumble through a conversation with someone with limited English, or you pantomime some of the conversation to get through, but that people are able to develop those connections and learn from one another and recognize the strengths and really be able to, like I said, emphasize those strengths that refugees and immigrants bring into the community. Because I think so often we look at refugees and immigrants as people who can learn from us and who should adopt our culture, who should take on something from us, when really there is so much we can learn from our immigrant neighbors about resilience and about strength, and that we can have that kind of cross sharing.
I think for me, I guess one of the things that I would love to see in the future is that the LGBTQ youth are invited to more things. They're mostly kind of tossed aside. You don't see a lot of LGBTQ students on panels or in groups. So that's the one thing I would love to see for them. And then I think just as a personal goal, I would like to see the center be able to open up 5 days a week instead of the 2 to 3 days a week that we're open now. So, and just be able to continue those parent support groups and to be that resource for the community, for any parents or students or teachers that are looking for resources. I don't know, people probably didn't know, but pre-COVID, I had a panel of about 6 kids who did different series virtually in the community, where they talked about pronouns and they shared a language and they shared what it was like to be transgender. And so I'm hoping to get back into that as well.
I wasn't aware of that, Lori. So you've sort of ceased doing that right now.
We've got it planned for 2022 again.
Oh, awesome. I might reach out to you about that. That's excellent. Kind of a specific question for you then, Lori, too, before I move on to Tony. So similar to what I asked Sarah, if I'm a parent and, my son just came out to me as that he's transgender or struggling with his sexuality, can I reach out to the center directly? Is that, or how would you advise me? I'm struggling with it as a parent because I don't understand it.
Usually, the parent will reach out to Tanager. They'll send me usually the email. And my approach that I've actually used that has really been working really well is, even though I might meet with the parent, I bring in another parent because it seems to work a lot better.
Mm-hmm.
It seems that parent is able to discuss what they've gone through.
Mm-hmm.
And I've had a lot that have formed some really good friendships.
That's awesome. That's awesome. Don't be surprised if you hear from me, Lori. All right. Tony, how about you? You want to go next?
Sure. My one hope, or one of my hopes, is that Linn County and the communities of Linn County will remain hopeful, because hopefulness helps you, it produces a brain chemical that really helps us get the courage to overcome barriers. So if we can remain hopeful, I think that, and continue to come together and work together. I've only been working in the community for 2 years, and just, it's amazing the number of people that I have encountered coming together around this issue of gun violence, whether it's healthcare or public health or the police department, there's nonprofits, law enforcement, human services, all of them are starting to come together around this. So just continue to stay hopeful and then continue to come together and work together.
Amy, from a public health perspective, anything you'd add to that?
Yeah. So definitely, excuse me. I think kind of going off of what Tony and some of the others have said, just continue to work together and creating that hope in our community, but also building trusting relationships between both the organizations and our community members. I'd really love to see that relationship blossom. And I think it'll do well for increasing that hope and moving forward and helping make some of the solutions to all of the crisis that people are going through right now. And I would also say more things for youth in our community to help them build relationships with one another, but, be proactive or pro-social interactions with one another, and kind of build some skills as well.
Thank you. I do see there's a question in the chat that just came through, and it says there's a lot of stigma in the African-American community regarding talking about mental health issues. What specific strategies can be used to help community members discuss this topic? Is there anybody comfortable who's willing to speak up about how to talk specifically with people in the African-American community about mental health?
I'm not sure I'm a one-trick pony or not, but
Oh,
think-
you are, Tony, go.
but if you start talking about stress, so it has less of a stigma, because stress is the foundation of a lot of mental issues, and so that's the way to ease into it, so we don't scare people away. But I think that's one way that we can reframe it is around reducing or managing stress.
Yeah, I agree. And I think it, again, taking a step back and normalizing talking about mental health, as well as one of the things that I've been trying to intentionally change in my own language is using the term brain health versus mental health. And I think sometimes that helps people think about it a little bit differently too. And Anne did put in the comment to Ann Carter, who's been instrumental in this Make It Okay work and other areas of the community, that people can reach out to her as well. Anybody else want to comment though? Sarah, you talked a little bit about, some of the immigrants and even just culturally how talking about or even accepting help for mental health conditions is a challenge.
Yeah, I think, you hit the nail on the head with that, with talking about it in different terms, changing the way that we talk about it, or how we're introducing the topic is something that we often talk about. We see the psychosomatic impacts a lot with our immigrant and refugee clients, especially. And so talking about, hey, your stomach pain might be because you're stressed. And that stress is manifesting itself in your body. And so what are the words that we're using and how are we introducing it really is that first step, I think, in destigmatizing it and making people feel comfortable talking about what's going on and what they're struggling with.
Right.
We do a lot of cohort groups where we get a group of individuals together and we're dealing with, all the stuff I'm talking about, we're dealing with all that, but we're dealing with a group where people see that they're not the only ones that feels this way. And so it starts normalizing the fact that we're all struggling with something. So I find a lot of benefit to doing small group work.
That's a really good point. That's, I think probably, Lori, that's similar to some of the work you do when you're in a group with other people who look like you, feel like you, talk like you. It normalizes it. And that has been harder in COVID because we don't get together in groups as much.
Right.
I think from the youth perspective, I think when it comes to mental health, I have this shirt that I wear that they just seem to really love it. All it says is therapy is cool, but they think it's just the greatest thing. And I know that at Garfield, they have talked to students about medication and some of them taking their own medication and even going as far as to one of the adults I know doing the clock goes off, it's time for my meds. And the kids even doing that, reminding that it's time for you to take your meds and then I'm going to take my meds. And like you said, that making it normalizing that it's okay to be on medication. So
that's awesome.
yeah.
That's awesome. Unfortunately, my clock says 12:59. I'm not sure what Sarah's. Hers was about 2 minutes ahead of mine for a while there. So I don't see any other questions. I just really want to thank everybody on this panel today. it's been a really interesting conversation. I probably could have talked to you all for longer, and don't be surprised if I reach out to many of you, because I feel like I've built a relationship and I want to like sit down and have coffee with every one of you. So thank you so much for being a part of today.
Thank you.
Thank you.